Hello guys and welcome to this video, and in today's video we're going through the unit IB, and in the unit IB we're going through the element IB1, which name is managing occupational health. So let's get started. So the first thing that we're going through is nature of occupational health, and in this part we're going to study the three basic definition. So we're going to study the meaning of health, the occupational health, and the well-being. So these three things are the basic part of the unit IB, and we need to understand what is health, what is occupational health, and what is well-being. So health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Next, we have occupational health. So the occupational health is concerned with the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. So the next thing we have is well-being, a state of being with others where human needs are met, where one can act meaningfully to pursue one's goal, and where one enjoys a satisfactory quality of life. So the next thing we have is the categories of occupational health hazard. So basically there are 5 occupational health hazards. So number 1, chemical hazard. So the examples are dust, fiber, gases, vapors, etc., and the associated hazards. Next is physical hazard, and the examples are noise, vibration, radiation, heat, etc. The third is biological hazards, and the example is bacteria, fungi, viruses, mites, insects, etc. And the fourth one is psychosocial. So the examples are stress, substance misuse, violence at work, etc. And the fifth one is ergonomic hazard, and the examples are posture, workplace layout, etc. So the next thing we have is the prevalence of work-related sickness and types of ill health. So in Great Britain, work-related ill health kills an estimated 13,000 people each year, of which work-related cancer and lung disease account for over 90% of cases. Around 1.4 million people suffer from illness, long-standing as well as new cases they believe is caused or made worse by their current or past work. Around half of these cases are new cases of illness. The HSE collates ill health statistics from a number of sources such as RIDER, the Labor Force Service LFS, and the Health and Occupational Reporting Thor network. So the next thing we have is the occupational health and the public health. So there are strong links between the occupational health and the public health, particularly in the cases of serious health issues which will impact individual and employers. Example include the H1N1 pandemic, SARS, near pandemic, asbestos, and smoking. So these are the study questions, and I will go through the answers of these questions in the next video, but make sure you write down these questions. So the first question is state the 5 categories of health hazard and give an example of each. So this is a very important question. Make sure you prepare this question very properly. And the question number 2 is outline some of the main sources of data used to compile occupational ill health statistics. So this is also a very important question, and I will answer these questions in the next video. So in the next part we are going through the management of return to work. So basic principle of biopsychosocial model. The biopsychosocial model is a way of considering human ill health as being more than simply a case of medical disease, but a combination of biological diseases and psychological responses by the individual within a social context. So biological, physical or mental health condition. Psychological, person, psychological factors also influence functioning. Social, importance of the social context, pressures and constraints on behavior of the functioning. Next thing we have is the fitness to work standards. Fitness to work standards are standards that work are assessed against in order to ensure that their level of fitness is acceptable for the specific type of work that they are doing. For example, in UK, the statutory medical for large good vehicles LGV drivers that they would have to undertake in order to first obtain their license to drive on public roads, followed by 5 yearly reassessments from age 45 onwards. Fitness to work standards may exist as part of statutory requirement, or alternatively may be non-statutory industry guidelines, good practice, or some other non-statutory codes. Next thing we have is pre-placement health assessments. Pre-placement health assessments are undertaken by health professionals as part of the risk assessment process after a job offer has been made. The pre-placement assessment can consist of questionnaire and or medical examination. The result of the assessment are that the worker is classified as fit, unfit, or provisionally fit to do the intended job. Next thing we have is managing long-term and short-term frequent sickness and incapacity for work. So, managing short-term frequent absence. Short-term absence is where employees repeatedly absent for short period of time, such as 1 or 2 days. Key steps in managing this type of absence include proactive application of company policy, return to work interviews to establish real reasons for absence, procedure to deal with unacceptable absence level or breaches of the policy, use of trigger mechanism to review the attendance, early involvement of the occupational health professionals. Managing long-term absence. With discussion and employees return to work from long-term absence, it may be appropriate to consider phased return, lighter duties, amended shift patterns, retraining, a buddy system with a colleague, risk assessment of the task, and an adjustment identified to prevent repeated absence. Key principles are identification of someone to undertake initial inquiries, keep in contact with the individual, flexibility and restricting sick pay, detailed assessment by relevant specialist, health, occupational or rehabilitation interventions, change to work pattern or environment. Next thing we have is the key element of managing sickness absence or recording sickness absence, maintaining contact, return to work interviews, making use of professional advice, planning and undertaking workplace adjustments, agreeing and reviewing a return to work plan, rehabilitation program, coordinating the return to work process. Next thing we have is National Institute for Healthcare Excellence NICE Guidance PH19. So, summarize the approach to the management of both types of absence as stage 1 initial inquiries by a suitable trained and impartial person within 2 to 6 weeks of the absence starting to determine the reasons for absence, barrier to return to the work, and the options to return to work. Stage 2 is detailed assessment undertaken by a relevant specialist as coordinated by a suitable case worker. This assessment has the same aims as the stage 1 inquiries and should identify the range of interventions and support services that will facilitate the return to work, perhaps with agreement of a return to work plan. So the stage 3 is interventions and services. The delivery of various interventions and services identified by the detailed assessment. Next thing we have is vocational rehabilitation. Vocational rehabilitation is concerned with helping someone with a health problem to stay and return to and remain in work. Benefit of vocational rehabilitation. There are benefits from rehabilitating workers back into workplace for employers' benefit. Simply measures to prevent and manage health can lead to decrease in employee absence, improve productivity and competitive edge, healthy working environment contributing to a reduced employee absence through sickness and stress. Employees feeling cared for and are so often more satisfied and perform better, which can have the effect of reducing staff turnovers and increase productivity. Getting employees back into work after illness, which reduces the loss of experienced staff and the cost of recruiting a new staff. So this is the most important point. Next thing we have is being known as an organization that cares about employees, which can enhance business reputation and help to attract staff and customers. Vocational rehabilitation. Employee benefits: better physical health, better mental health, increased financial security. So next thing we have is overcoming barriers. The biophysiosocial model can be used to identify barriers to the rehabilitation of ill workers and has been used in rehabilitation of workers with MSD and other common related conditions. Biological barriers: the physical disease, ill health condition and disability or mental health condition that the worker might be suffering from. Psychosocial barriers: fear of returning to work, concerns over the opinions of colleagues, anxiety about future prospects. Social barriers: access to and from the workplace, appropriate sanitary conveniences, workstation design and layout. Next thing we have is risk assessment. A risk assessment may need to be carried out or reviewed in light of workers' return to work to ensure that the hazards and the risks associated with their work have been properly considered. A personal a personal emergency evacuation plan (PEEP) may be necessary for fire evacuation. Role of other disciplines and external agencies. Many external agencies offer the help and support both for employers and employee during the vocational rehabilitation process. So next thing we have are the study questions. So I will go through these questions and I will give their answers in the next video. So the questions are: give 3 examples of occupations where they are likely to be defined fitness to work standards. Very important question. Outline the meaning of vocational rehabilitation. Also important question. Question number 5: what is the biopsychosocial model? Very important question. So I will answer these questions in the next video. So the next thing we have is managing occupational health. Occupational health services. So occupational health services are responsible for advising on the requirement for establishing and maintaining a safe and healthy working environment, which will facilitate optimal physical and mental health and the adaptation of work to the capabilities of workers in the light of their state of physical and mental health. Occupational health services require the involvement of a range of professionals, including physicians, nurses, occupational hygienists, ergonomists, and safety engineers. An example might be the recognition of a particular health effect by a worker, safety representative, nurse, or doctor, diagnosis of the illness and treatment by a nurse or doctor, discovery of the environmental cause by a hygienist, implementation of controls by a safety engineer, hygienist, or ergonomist. Occupational hygiene involves recognition, also known as identification, identify those factors that may cause harm, measurement, determining who is affected and how much, evaluation, making a judgment on the risk posed, control, putting measures in place to reduce or eliminate the risk. Next thing we have is the role and benefits of occupational health services. So, statutory compliance with the health and safety and equal opportunity legislation, reducing in the absence rate and number of days lost through ill health and resulting costs associated with the absence, improve management of rehabilitation and return to work process, early recognition of work-related health hazards, allowing for improved identification, assessment, and control, improved management of work-related ill health, allowing for earlier and better treatment and consequently better recovery and minimization of ill health, reduction in ill health compensations claims, better screening prior to employment to allow a matching of personal characteristics and job requirements, improved worker morale. Next thing we have is makeup and functions of typical occupational health services. So the first thing we have is occupational health physician, concerned with the diagnosis and assessment of health hazard and stress to work. Specialist branch of the medical profession. Certain types of work can only be performed by an occupational health physician. Occupational health nurse. Specialist branch of nursing profession, rarely involved in the direct treatment of injury or ill health. Concerned with proactive prevention of disease and ill health, management of treatment and care program. Occupational health technician, or developing role, some aspects of health surveillance under supervision. So, occupational hygienist, in concern with the measurement of risk and interpretation of result, making use of special equipment and instruments, measurement of airborne contaminants and comparing the result with those published in the standard, for example EH40, measurement of heat, noise, and other pollutants, measurement on ventilation systems and other environmental control devices to ensure they operate at optimum performance, determining competence within the occupational health. So there are minimum standards of qualification and registration for occupational health doctors, occupational health nurses, specialists such as audiometricians. Typical services offered by an occupational health service: pre-employment and pre-placement screening, health surveillance, Return to work rehabilitation program, sickness absence management, counseling, risk assessments, health education and promotion campaigns, treatment services, management of first aid and immunization programs. Next thing we have is health assessment and health surveillance. So general health assessment of an individual's fitness to carry out general duties or specific tasks associated with work. Health surveillance is more specific assessment of a worker's medical fitness that focus on specific aspect of health in relation to a particular hazard or hazard group. The intention of health surveillance is to determine a worker's state of health with regards to the hazard and then to track that aspect of their health forward in time through repeat assessments. Health surveillance is only required where the following criteria are met. There is an identifiable disease or adverse health condition related to the work concerned, and valid techniques are available to detect the indications of the disease or condition, and there is a reasonable likelihood that a disease or condition may occur under the particular conditions of work, and surveillance is likely to further the protection of the health and safety of the employees to be covered. Health surveillance is normally provided where there is a clear statutory duty under specific health and safety legislation. Health needs assessment. Health needs assessment HNAS can be used to identify the occupational health priorities that are of concern to the workplace, so that an appropriate occupational health services response can be planned and implemented. Key stages in carrying out health needs assessment are: Stage 1, obtain senior management commitment and resources. Stage 2, decide on the method of data collection, survey, interviews, focus group. Stage 3, consider the physical and psychological demands of the job, the individual's health effect on the job, and adverse health effect of the job on individual. Stage 4, gather the data. Stage 5, analyze the data. Stage 6, develop and implement the workplace health and well-being strategy. Stage 7, review, evaluate and monitor progress. Standards in occupational health provision. The Safe, Effective, Quality Occupational Health Services SEQOHS scheme is a set of standards and voluntary accreditation scheme for occupational health services in the UK and overseas. The scheme is managed by the Royal College of Physicians of London, UK, and provides evidence to a service user that the occupational health provider meets the acceptable standard. Next thing we have is the study questions. I will answer these questions in the next video. So, question number 6, outline the typical functions of an occupational health service. Very important question. When is health surveillance a requirement of good practice? What is the purpose of carrying out a workplace health needs assessment? Very important question. What is SEQOHS? This is also a very important question. So now the element IB1 is complete, and I hope you understand everything. So in the next video we will answer these 9 questions. So see you guys in the next video. Bye bye.